Hi guys, my name is Dany Watt, and the disease that I chose for my project was mumps. If Even if you don't know what mumps is, you've probably heard of it before. It's one of those big childhood diseases like chickenpox or measles. So just rolling right into the signs and symptoms of it. The most common ones include fever, headache, muscle aches and pain, loss of appetite, and tiredness. It's most well known for the swelling of the salivary glands on the side of the face, which is known as parotitis. I think that's how you pronounce it. It can happen on one or both sides of the face and usually is also associated with pain or tenderness around the location of the swelling. Um, but despite being what mumps is most well known for, parotitis is not exclusive to it. It does show up in other diseases as well. And it's also only shows up in about 50% of actual mumps cases. So there are some additional complications with it that are not technically symptoms, but they do show up. If you have mumps, it's especially common if you are not vaccinated. And they might show up even if you don't get the swelling. And those include swollen testicles in males or ovaries in females. That's more common if you get mumps after puberty, and it has no effect on your fertility. So when the disease goes away and the swelling goes back down, you're completely back to normal there. Encephalitis is also one of the complications, which is swelling or inflammation in the brain that can cause tissue damage. It can cause changes in your levels of consciousness, seizure, or loss of muscle control, and like spasms and stuff like that. Meningitis is inflammation of the membrane around the brain or of the spinal cord, and that can cause additional headache and fever or stiffness in your neck. Sometimes mumps can cause hearing loss, which can happen very quickly or over time, but that usually gets better after the disease is gone. Pancreatitis is pain or tenderness in the pancreatic area near your stomach. Can also cause upset stomach like nausea, vomiting, or additional fever. And if you get mumps while you're pregnant, especially in the first 12 weeks, it can cause a miscarriage, so you'll lose the baby. As far as the causative agent, it is caused by the mumps virus. I know, obviously, mumps caused by the mumps virus, not very original. But that is part of the paramyxoviruses group. It does affect people worldwide, so it's not really localized to one area. And you can be contagious anywhere from a few days before the glandular swelling up to 5 days after you start swelling. And during that time, you should try to limit social interaction, stay home, don't go to class, don't go to work, don't go to parties. It's also possible to be an asymptomatic carrier, so you might not swell up at all. You might not get anything other than just kind of like the headache and the fever, which is why it can be a little bit difficult to diagnose, but we'll get more into that later. So the microbiology of the virus itself is roughly spherical. It's got an outer membrane that envelops an inner coiled helical structure. That outer membrane envelope is covered with spiky glycoproteins that include a fusion protein, which fuses the viral and host membranes, so it combines the cells, and a attachment protein. And then the inner structure, called the nucleocapsid, is a hollow tube that consists of a single-stranded RNA polymerase that associates with the matrix proteins that line the inside of that outer envelope membrane. And it's kind of hard to see because my face is covering it up. Sorry about that. But there's a 3D model here of what it looks like. And then I also included another picture of it here. that's more of a breakdown of what it looks like. So pathogenesis, it is transmitted via droplet spread. So it's mostly airborne. If somebody coughs or sneezes and you breathe that in and they were infected, you've got a pretty good chance of getting it. And then it replicates in your nasal passages or your upper respiratory tract epithelial cells, and then spreads through the blood to your salivary glands and other major organ systems. It tends to affect activated white blood cells, so as your immune response is trying to get rid of it, it's actually attacking those immune cells back. And then it will invade your central nervous system, and it can last for up to 14 days after your first symptoms. So the virulence factors, it infects your ductal epithelium initially and produces intracytoplasmic inclusions and viral antigens. And then it eventually desquamatizes those epithelial cells. It destroys those cells, which causes the immune reaction of inflammation, which is where the swelling comes from. And then it also frequently disseminates to your kidneys and the epithelial cells in that area, in your distal tubules, your calyces, and your ureters are primary sites of replication as well. So it's virulent because of the way that it replicates and the way that it causes that inflammation. It does occur endemically worldwide. It has decreased drastically since the vaccine was first introduced in 1967. So there was a lot more cases before that, but vaccination has helped a lot with getting rid of that. In hotter climates, it occurs throughout the entire year, and in more temperate climates, it tends to peak in the winter and the spring. It's most common in children between the ages of 5 and 9 years old, and kids under 5 that get it usually also get an upper respiratory infection, but they don't get that pericarditis, they don't get that swelling. In the year that the vaccine was licensed, so in 1967, there was 200,000 cases in the USA alone, but it's gone down like a lot since then. Probably the biggest outbreak in the USA since then was in 2006, where there was over 6,500 cases. And there was also a really huge epidemic in the UK in 2004 that was over 56,000 cases. That's like way big. And then as far as mortality rate and the way that it's affected in the USA, it's a 1 in 10,000 mortality rate, and it's usually caused by that encephalitis. So it's if you do die from it, it's usually because of that brain tissue damage. Sorry, I got those slides out of order, but I included a picture of like reported cases in the US from the year 2000 to now. So you can see that aside from those couple of big outbreaks, it's usually fairly low. There's a couple hundred cases a year, which, considering how many people live in the USA, is not many at all. Transmission. So typically it is droplet transmission. So it's airborne. It's that coughing or sneezing or talking. It can also be transmitted through indirect contact or direct contact. So if someone who's infected drinks out of a water bottle or cup, and then you drink out of that same water bottle or cup, and their saliva gets into your system, you're going to get infected. Or if you kiss or have like very close contact with someone who is infected, just anything that's going to get their saliva into your system is going to cause an infection. Because it is a saliva-based virus and a saliva-based transmission, diagnosis is typically done by a cheek swab. That's most effective during the first 4 to 5 days of seeing symptoms. A urine test can also recover the virus up to 2 weeks after symptoms begin, but it's typically only used as an additional test. It's not like the main way of diagnosing, and blood testing may show an immune response to the virus. So, virus isolation, that's going to be your saliva sample. That's immunofluorescence using a mumps-specific antiserum can detect the mumps virus antigens as early as 2 to 3 days after it's inoculated and incubated. And those techniques not only provide direct confirmation of the isolation, but they also, if you do it correctly, can specify the specific, like, mumps virus itself. So it's not just going to show that you have a virus, it's going to show mumps specifically. Nucleic acid detection is a little bit further additional testing. That's going to be reverse transcription polymerase chain reaction, or RT-PCR testing can detect the mumps genome sequences. So that's going to look specifically into the DNA of the mumps virus. And that's done as like an additional test for samples that returned a negative result in isolation. It can identify the specific strains and also provide information for epidemiologic studies. So that's for if you're doing like analysis or comparing worldwide. And then finally, serology can check if you have like the antibodies. So if that's going to be like your blood testing to see if you've got an immune response to it, and that uses the ELISA or HI tests. But having the antibody alone is not enough for a diagnosis because you could have it naturally. Like if you had mumps as a kid and then you develop the antibody and it's still in your system, or if you got the vaccine and it's still in your system, it can return like a false positive. Like you'll have the antibody, but you don't have the actual disease. So that's typically used with the other tests rather than by itself. Then for treatment, there is no specific treatment or medication for mumps. Antibiotics don't work on it because it's a virus, not a bacteria. So really the only thing you can do is just wait it out, let it run its course. So if you feel tired, rest. If you have a fever, try to keep your body temperature in homeostasis. Gargling with warm salt water can help your inflammation go down. Using like eating ice pops or using ice packs can help with the swelling. You don't want to eat anything or drink anything that's acidic or too like crunchy or difficult to chew because you're going to have that tenderness. And aspirin can actually react with the virus and make it worse. So you want to use a non-aspirin medication like acetaminophen or ibuprofen to control pain and reduce fever. For prevention, there is the vaccine. The measles, mumps, rubella, or MMR vaccine is part of the standard childhood immunization schedule. So it's 2 doses. You get your first one between 12 and 15 months old, so when you're about a year old. And then you get your second one anywhere between 4 and 6 years old. There is also the measles, mumps, rubella, varicella vaccine, which is the one that adds in chickenpox as well. And that one, if I'm remembering correctly, is 12 years old or older. But you can't use that as your first dose. So if you do get that one, that has to be your second dose. You still need the regular MMR when you're a baby. And then if you're immunocompromised or if you're allergic to gelatin or neomycin or you're pregnant, you should not get the vaccine because the vaccine itself can cause complications. And if you did not get the vaccine as a child and you did not get mumps as a child to get that natural resistance to it, you especially need to get vaccinated if you're a college student or living in close quarters with other people, or if you're in like the military or at boot camp or traveling internationally or a healthcare worker, just anyone that would be potentially susceptible to that close contact airborne droplet spread. And then here are my references. This first one, this was an absolute godsend. That one was more about the virus itself rather than the disease as a whole. And then I also used a lot of the information from the CDC, including that chart of the outbreak cases in the USA by year. That photo came directly from the CDC. And yeah, thank you.